This is Yuan from Gamma Center UVA. Here we present our study of sonodynamic therapy for metastatic melanoma and in vivo study. First, I would thank Focus Ultrasound Foundation for giving us the opportunity to present our study. Here we show some preliminary findings of that study. As we all know, melanoma is the third most common brain metastasis source following lung and breast cancer. Currently, stereotactic radiosurgery in conjunction with the immunotherapy and/or targeted therapy improve the patient's survival. However, the risk of radiation necrosis and the complications of those targeted therapy and immunotherapy renders new treatment modality warranted. The application of the focused ultrasound with a substance that sensitizes cells to damaging effect of is called sonodynamic therapy. Our previous study researchers have demonstrated that the cytotoxicity of SDT in inhibiting tumor cells proliferation was based upon the generation of a reactive oxygen species, which mediated the upregulations of p53 and the induction of a tumor cell apoptosis. The ability to deliver highly focused ultrasound to the brain target through the intact skull has become feasible. Thus, our previous in vitro study also showed that cytotoxicity of SDT in the presence of 5-ALA in killing melanoma cells, cell line B16F10 via MTT assay. The object of the study is to develop a SDT treatment approach for melanoma brain metastasis. Aim 1, we want to determine therapeutic efficacy of a 5-ALA-based SDT on one-sided inoculated melanoma and a possible abscopal effect on the contralateral side of tumor. Furthermore, we want to characterize mechanism of action, including cell death, necrosis, apoptosis, and the modulation of immune cell subsets. In the aim 2, we would like to determine whether 5-ALA-based SDT of a subcutaneous melanoma can also confer an abscopal effect on the tumor growth control of an intracranially inoculated melanoma model, which mimics brain metastasis. In these slides, we inoculated 400,000 of B16F10 cells in the right flank of mice. It generally takes 7 to 8 days to reach the exponentially growing phase. We randomized the mice for various treatments at this time point. Here we show that the uptake of 5-ALA, due to the poor imaging quality, it is really hard to appreciate the fluorescence appearance here, which shows on the skin of the tumor on the skin, attached in the skin. Here's another sample on the left pictures. It shows the positive control, which is a C6 Vista cell, C6 bearing Vista rat, 4 hours after the 5-ALA injection. You can see that the whole tumor appear pretty reddish. On the right side is the negative control of C57BL 6J mouse, which without any 5-A, so the tumor appear pretty dark. This slide shows on the left side is the negative control again, and the right side probably can see that the tumors still attaching the skin, and it shows some red colors, which is the fluorescence of BP9. We also quantitate the fluorescence intensity by using the plate reader at a UVA core facility. We can see that approximately 10 times more fluorescence intensity showing in the melanoma following injection of 5-LA, which is in mouse 1 and 2, compared to the negative control, mouse 3. On the left, that shows that a standard curve of a PP9. So the conclusion, the current study demonstrated the success of uptake of 5-ALA in mouse melanoma subcutaneous model in addition to the tumor growth information, which paves the way to next phase of the present research. This is an ongoing study, a longitudinal survival study, and a tumor growth monitoring in 24 melanoma-bearing mice is ongoing now. We would like to do the subsequent immunohistochemical characterization of SDT-induced cell death mechanisms 72 hours after the treatment via H&E staining and immunohistochemistry staining for K-Space 3 and the POP1 staining. That's all. Thank you.